Welcome back. Changes in your cycle and trouble getting pregnant are just some of the effects of a common painful syndrome that many women suffer from. If any of these sound familiar to you, then the next few minutes could help you out a whole lot. Take a look.
Hey ladies, welcome back to Girl Talk. So today we're at the Institute for Women's Health with Dr. Evangeline Ramos-Gonzalez. How are you, doctor?
Doing well, thank you.
I'm glad to be here with you today. So we're talking about polycystic ovarian syndrome. It's more common than you think. Unfortunately, it can affect your health. It's important that you know what it consists of. So what is PCOS?
Polycystic ovarian syndrome is a condition in women that is associated with abnormalities in the metabolism and production of their male-like hormones. A lot of women don't realize we make male-like hormones produced in the ovaries, but in some cases, in these women with polycystic ovarian syndrome, they have an imbalance in their male hormones. They have more male hormones than their female hormones, which causes them symptoms. It's actually a pretty common finding, fortunately, and we see up to 1 out of 5 women who complain of irregular periods are diagnosed with this condition.
Okay, so when you see patients, what are the symptoms they complain about?
The most common symptom they come in with is the irregular periods. Either they have very few periods in a year, no periods at all, or they're bleeding excessively when they do bleed. Bleeding excessively with a period or bleeding for long periods of time, months at a time.
Okay, so would you say that is definitely something to look out for?
It's the most common symptom, but it can also be associated with abnormal hair growth along the jawline, the chin, the chest area, the lower abdomen. It can be associated with acne, weight gain, and lack of ovulation.
I see. Okay, so what if somebody has those symptoms and they don't see a doctor? What can happen?
Unfortunately, the majority of these women also have issues with insulin resistance, which is a precursor for diabetes. So it can lead to diabetes or type 2 diabetes and all the related diabetes medical health problems. We can oftentimes see high blood pressure, high cholesterol levels, heart disease, uterine cancer. All of these are very dangerous conditions that if they go undiagnosed could develop.
So when you find a patient with PCOS, what is the next step? What kind of treatments are out there?
Well, when a patient first comes with those complaints, usually the menstrual complaints or the hair growth complaints, physical exam first and foremost. And the things that we're looking for on physical exam are the acne, the abnormal hair growth pattern, the body habitus as far as the weight gain, especially in the midsection of the abdomen. On palpation, as far as the pelvic exam, sometimes they'll have a little slightly elevated ovaries. Other times they're not, remarkably enlarged. But then we do labs. We check specific labs, hormone levels. We check other labs to make sure it's not another that there's not another cause for the abnormal androgen levels or the abnormal male-like hormones in their bloodstream. So we want to make sure we're not just jumping to the conclusion that it's polycystic ovarian syndrome. We usually will perform a pelvic ultrasound, and that's to actually directly visualize the ovaries themselves. And what we're seeing in this situation, in this condition, these ladies have ovaries that have multiple small cysts within each ovary. So the ovaries are filled with these tiny cysts, but they're not functioning the way they're supposed to, and they don't allow the ovary to function the way they're supposed to.
Okay. Now, ladies, polycystic ovarian syndrome is something very common that it could be affecting you. So you need to come over to the Institute for Women's Health, ask for Dr. Ramos-Gonzalez so she can help you find a treatment.
And thank you for that, Claudia. If you would like more information, you can go and visit them at the Institute for Women's Health. They are on McCullough Avenue. The phone number is 226-9705 and the website ifwh.org. They're also on Facebook and Twitter. Well,